So remember to avoid sharing any protected health information. To use the chat, we're managing questions in the chat panel. We're mostly going to be just doing the outwardly questions, but if you have something in the chat, we'll try to hurry and catch that and answer those questions. To get the slides, we don't have them posted just yet, but we will after this meeting on the Case Management Redesign webpage. So if you are listening by phone, go ahead and press *6 when it's time for you to unmute your line, or *9 to raise your hand. This has closed captioning abilities, so click the live transcript icon at the bottom of your screen if you need closed captioning. And meeting information for all of these has been on the Case Management Redesign website. There will be a rule tab, and if you wanted to go back or reference anything that we have gone through at any of our past meetings, they will be in there. For housekeeping items, we are recording this meeting with the intention of posting the webinar recordings on the website following the meeting, so you can find all of our past recordings on the Case Management Redesign website. So please be cognizant of sharing any personal or protected health information, either verbally or in the chat throughout the meeting. So the chat is available for everybody to copy, but we ask that you wait until after, because we also go through the chat to make sure that we take out any kind of protected health information in there before anybody can copy it. So for our next housekeeping item, you may also provide comments verbally. To do so, click on the raised hand icon to be put into the speakers queue. And John will be helping to manage all of this. Our friend John Barry is here to help me navigate all of this process. When you're called upon, please first identify the line item number on the rule log that you are addressing, as well as your input. So I'll get into that a little bit more of what our purpose is here for those rule log line items. You'll have 2 minutes to ask one question, and each person may ask one question at a time. So for our agenda today, we'll go over what anybody who's already been here has kind of gone through. I'll go through it really quickly. Just the reason for change, the goals for the role updates, and our roles and responsibilities. But the main purpose for this meeting is to go over the HCBS service rule log review and get any other outstanding questions that you all have out of the way for that. And we're doing just our final rule wrap up. So the purpose of this meeting, it's an open session with a focus on specific listening log items. So stakeholders will have, for any questions that stakeholders have about listening log items that maybe weren't answered yet, or we did answer and you want some more clarity around that. You can go right into that listening log number, give us that number, and we will have our subject matter experts here to answer those questions directly related to that listening log item. So topics of conversation will be directly related to the follow-up of the rules that have already been presented in each of the Case Management Redesign meetings. So anything that I've already gone over, and you still have questions about, we will try very hard to find that area and get those questions answered for you today. So our rule process, for anybody new, oh, John, go ahead.
Thanks, Nicolette. I didn't mean to interrupt you. I just wanted to, before we get started, I know Nicolette's not done, folks, I just want to say as I understand it, the content is slightly different. We're not going directly through rule line by line. We're addressing questions about things. And so I'll be taking the same tack as, but I just wanted to explain about the 2-minute thing. I have a timer and we have now 115 people in the meeting by my screen. So 2 minutes means that if you have some comment or question and you take some time, then we respond. And if you have an additional response to that, I'm still using that 2 minutes as the time you have in total. And as the meeting goes on, what I've been doing is, if I'm seeing people who haven't spoken before in the meeting, trying to make things fair, I will call on them, and that might be out of order of the hands raised, but that's what I'm doing. And I'm not trying to avoid anyone at all. If you have a comment or a question, and then you have another one, you need to put your hand up again and sort of go back at the beginning of the queue. So just want to put all that out there. Thanks, Nicolette.
Thank you. Perfect. Thanks, John. Okay. So for our rule process, what we've been doing is our subject matter experts that are here to answer questions for you. They are the ones who have written the rules. They have been in all of this. They've prepared the drafts with us. They've put in all the language. They are the subject matter experts. So they're the ones that have prepared all those drafts that I have been reading out loud to everybody. So the Department of Healthcare Policy and Financing, HCBS, brings the drafted rules to you all, and we've reviewed them. So our subject matter experts and HCBS leadership incorporate approved updates. So you'll see in the rules the areas where it will say in the listening log, unable to adopt, or some were just questions and we resolved them with an answer. So that's been kind of the way that we've worked that. And then afterwards, something that you may not know to make sure for anybody who's had some worries of, how do we know that this is then going to get into the final rule? Well, we have been working very hard and collaboratively as a team to go through the listening log items line by line, seeing anything that we have said we are going to adopt with modifications. And then we go into our rule drafts and we tag that particular SME to make those updates. SME, subject matter expert, apologies. And then they go into the rule and directly make sure that they have made those updates and followed up on the promises that we've made for those changes. So the case management redesign team sends the rule draft for approval to program integrity, leadership, budget, and legal. And I submit those through our e-clearance. And then we have a final draft ready that we will present to MSB, our Medical Services Board. So the rule process revision, it's huge. So what we're going to do is we're going to take all of this to MSB before we take it to final MSB, just to make sure that they know what we've done, how big this is, and so it gives them time to digest before we do the final Medical Services Board meeting. And then we will coordinate who posts for public comment. So once we are ready to go to Medical Services Board, before that happens, it will go to a public comment where it will be posted and there will still be time to comment on those final drafts that you're going to see to make sure that we caught everything that we had promised to. So then we present and hopefully those rules will be in effect January of 2024. Our rule timeline, we started the stakeholder engagement in October and our final is today, June 27th, for our final reviews. The drafts we want to have completed by September of 2023. So again, like all those drafts that you see, we are still working on them because we have to get them updated with everything that we have said that we are going to update. So initial and then getting it in for that e-clearance. Our initial preparation meeting with the Medical Service Board will be September, public comment in October, and our hearing we hope to have in November. Final rule adoption, again, January 2024. So just so that you have an idea of why we've done this, because the regular rule structure, the way that we had it, it's fragmented. It's in lots of other areas. It's kind of sometimes hard to read, interpret, or find. So the new rule structure that we've gone through is we've done the member rights and responsibilities, our waiver, our CMA, CCB requirements, provider requirements, and service definition. And we have read through all of those. So for all of you who have stuck in here with me and listened to me read aloud all of these documents, I'm grateful, and we're grateful for all of the input that we've received. Goals for the updates are to minimize duplication within the rules and make sure requirements are consistent across the program. Help everyone involved understand their roles and responsibilities, and a rule structure that's easy to follow and understand. So the restructure versus change is moving rules out around to be in a more accessible format and cleaning up language that's outdated or non-reflective of current practice. Any changes within the new is with the new statute and requirements in place for case management. We must make changes to rule to align for the case management redesign. So the roles and responsibility has been Tiffany, John, and myself have been introducing, reading, timekeeping, helping with that facilitation. Our subject matter experts, they address the questions, concerns, and comments as they relate to the rule updates and changes. And HCBS Strategies is our contracted provider that's helped with record keeping, listening for the listening logs, issues for further discussion, follow-up, assisting with walking through the rule changes, and recording and addressing any questions or concerns. Behind the scenes, they've done a ton as well with helping us prepare these rule drafts, and I'm very grateful for all the work that they've done with us. And they are building their crosswalk to make it easier to see the changes. So for the listening log items, we have 525 lines and counting. So this is obviously why we cannot go by line, but have requested that folks come and bring us the specific line item. And just to give you a little bit of a look at what that looks like today, the listening log status update, we have 111 accepted or accepted with modification in that listening log of the rules and questions that you all have raised. 221 are resolved. Those are usually because they're questions that we are just providing answers to. 36 line items that we were unable to adopt. Usually if there's something that was an unable to adopt, it's been related to statute that we in this project are unable to change, or it could be something that would request new budgetary asks and things like that. So that's been a lot of that, and 155 are under review still. So we still promise to have that by mid-July, and we are all working really hard to get all those answered for you. So along the way, if you see things and you see that we're getting some answers in there and you still have questions about it, please feel free to reach out to Tiffany or me. And so we've accepted 75% of the recommended changes, which means that you all have been amazing and helpful and very detail oriented in calling out so many areas that we maybe didn't catch or that we needed to rethink, language, just a lot of things. So your partnership has obviously been incredibly important. So thank you so much. And then the Colorado rules, go ahead.
Let me just, I noticed a hand, and I think after you finish with this piece, Nicolette, then I'll call if there's any questions about what you've gone over, and I'll take names for the go from there. Sorry.
No, you're good. Anything that we've done for stakeholder issues for further discussion, this is because it's not really related to the rules. We've added things in here that may be policy that is not related to what rule updates we are doing at this time. And that's it. So this is a perfect time, yes, John, for us to call for any questions so far. Thank you.
Great. Sorry about that. So we're going to be getting into the meat of this meeting in a minute here, but if anyone has any comment or question about what Nicolette just went over and just that part, looks like we have 2 hands so far. You can raise your hand in the queue using the raise hand button in the webinar. So, okay, just seeing 2. Let's start with Jose. Good morning, Jose. You have 2 minutes. Thanks.
Thank you. Yes, Nicolette, I have a clarifying, well, I'm not sure if for you, but for someone, clarifying question. Uh, I'm looking at the listening law and there are around 20 lines missing in the beginning. And I was wondering why.
Sorry, can you repeat that? There are lines that are what?
Missing, like for example, line 3 to 20, I think 20 are missing. 3 to 20 are missing. And I'm not sure why, or is it just me?
Yeah, and for the missing lines, there was some items that were in the listing log that were the same one, that they were combined into single items. We didn't want to delete the line items because some of the rows, when we were working with the department, like there would be some things where we'd go into the regulations, propose some draft changes, and note that that references to line 124 within the listing log. So we didn't want to delete anything, so we messed the numbering up. So that just reflects, you know, that was basically the same comment. We combined it within one line.
I see. Okay, got it. Thank you.
You're welcome.
Thanks, Jose. So folks, we have one hand left, but just because the process today is important. So if you do have a question or comment about what Nicolette went over, you can raise your hand now in the queue. I'll be looking. In the meantime, Rita, please go ahead. Thanks. You have 2 minutes. I was kind of fast there. Rita Noland, are you with us? Looks like your hand is raised. You can press *6 to unmute, or there's a mute button on the bottom of your screen on the left.
I think she's trying.
Okay, tell you what. When she shows up, we will take her comment question. In the meantime, because we do have a lot to cover and 120 people, so I'll turn it back over to you, Nicolette.
Just John, Rita said in the chat, it should not have been. I have no microphone.
Oh, thank you. I wasn't looking at that. Very good. Has no microphone. Well, Rita, if you want to type a question, comment into the chat, certainly you can do that at this point. Looks like we have Gary. Gary, thank you. Go ahead. You have 2 minutes.
Had to unmute. Okay, on a line item 413, it talks about what do you do about how do we deal and rule about continuing services after a termination notice has gone out to a Medicaid member? And currently in the listening log that says under review, and then there's no words after the under review. So I have no idea what HCBS is thinking about this.
Okay, thanks, Jerry. Let me check in with Nicolette. Were you done teeing up this conversation today, Nicolette? I'm not sure. Are we jumping into specific questions now?
It sounds like nobody had any questions. So let me go ahead and share the rule log and then we can jump right in.
Very good.
Okay, so 413, you said of the rule log, correct?
Correct.
Great. Okay, so this is for our provider agency requirement rule on 8.7509. Do providers have any responsibility to continue services after termination notice and if no other service provider is available? Do we have a subject matter expert that can speak to this question from our provider team? Sorry, let me see what we've got.
So Nicolette, this is Kidron. I'm not on the provider team. And I know, Jerry, this is specific to the provider rules. But I don't know, I'm assuming the provider team is working on a response related to the provider responsibilities. I don't believe that we would have anything in regulation requiring providers to continue services within our regulations. And that specifically is because providers have to have a prior approval to provide services. That's a Medicaid rule. And so really through the appeals process, if there's an adverse action or a termination, et cetera, that is made because a member is no longer eligible or an eligibility issue likely, then the member would go through the appeal process. And if they are appealing, then they have the right to receive those services through the appeal period. So is that in reference what the question was? Does that help at all?
Yes, it's not, I mean, it's sad, but I guess helpful, but so by mid-July, somebody, perhaps you, will fill in that blank in the listening log, so we'll be able to see the answer that you just gave, unless, of course, for some reason, your answer got changed.
Yeah, absolutely, Jerry. And yeah, we want to look at our regulations from the perspective of what we can have in regulation and how it matches with other rules throughout Medicaid. And the thing that really comes to my mind with this specific question is, we don't have the ability to make providers continue services if they don't have a prior authorization. So it would really be contingent on what services are authorized for a member in their service plan, what the assessed need was, and whether or not there's a prior authorization. If you're speaking to providers making a business decision whether or not they can provide services to a member, that is something entirely different. So if that's the ask, then it would be a different answer. But that's the best that I can do to jump in without anybody else able to jump in.
Thanks, Kidron.
You're welcome.
Thank you, Kidron. This is John. Folks, we are taking names now, and I put it in the chat for other items. So you can line up in the queue if you like. That'd be great. I'm monitoring that. Let me ask this, if there's anyone who's on the phone only, you can press *6 to unmute and give me your name that way. I don't know how many people are just on the phone in these meetings. There haven't been many. Okay, not hearing anyone. Let's move next. Jose, you're up next. Do you have 2 minutes? Thank you.
Thank you, John. Kira, as far as I know, according to Medicaid rules, Kira, I think I'm pronouncing your name wrong. According to Medicaid rules, whether a termination letter has been sent or not, if the client submits a formal appeal, they have the right of under Medicaid rules for continuity of services, and you said that. So my only clarification on what you said is, if a provider is not able to get a PAR for someone who has received a termination letter, but the client has appeal, what happens then?
So Jose, your question is if an adverse action has occurred for a member and they are appealing that and the provider does not have an active PAR, what do they do? Is that your question? Yeah, they would work with the case management agency to make sure that a PAR is continued during the appeal period. So we have training for case management agencies on how to do that. Our system allows for that PAR to continue during an appeal period. So again, it's nothing that we would have specific in regulation other than knowing what a member's rights are, that they have the right to receive services during an appeal period. And our system does allow that. We just need to train case management agencies to do that.
Yeah, maybe that's something that should be spelled out, because that's a right under appeal rights.
Yeah, it's a training. It's certainly a training thing that the department needs to make really clear for case management agencies on how to do that.
Thank
Okay,
you.
thank you. And everybody, I will move us forward. This is John again. So reminder, everybody, we're using the raised hand function today. So I'm not sure who SMB is, but thank you for raising your hand. Please go ahead. You have 2 minutes.
Hi, it's line number 418, still under review. For med management, unless provided by a person other than a relative was removed from rule. Still under review.
Okay, so this one is the provider agency requirement rules, medication management, the QMAP currently, regarding the QMAP, currently the rules state, unless given by a family member, are you doing away with this? I apologize if it's by a person other than a relative. And this is for 8.609.2F. This one we had that Cassie would look into it. Do we have any updates from our provider team in this? Has it been discussed or updated within the team yet? And we're going to try to find somebody really fast for you.
Hi, Kedrin. This is Meghana from the provider team.
Oh, she just froze. Meg just froze for me. Is that just me or is that everybody?
Frozen.
Oh, darn.
She's frozen.
Okay, well, let's come back to that one. I'm going to let her know in here that we're going to take the next one and then we're going to see if she is available after the next question.
Because currently family caregivers don't, because of the way the rule is current, they don't have to be QMAP. So all family caregivers that aren't QMAP will have to like rush to get QMAP'd.
Meg, you froze for a big chunk of that. I'm so sorry. Would you mind were you
Yes,
saying?
sorry. Apparently when my microwave runs, my Wi-Fi goes out.
Oh, geez.
So we are still looking into this. If
While her microwave is running, folks, I'm just going to put out again, if you have something you want to go over, it may be related to this, maybe not, you can raise your hand in the queue. And to reduce confusion and chaos in the meeting, I will ask the participants, please trust me that I'm monitoring the chat, I'm monitoring the hands raised. You don't need to jump in and help with that because again, sometimes I move around depending on what topic and what person is speaking. So, okay, Meg, are you with us?
I think she's
Shall we
pretty
come
frozen.
back?
Yeah, she's frozen. We can come back to that. It sounds like at least part of it is that we are still working on getting a definitive answer. I think she was just working through why that might be. But it sounds like we don't have a full answer for this just yet.
Right. Okay. It was kindly pointed out to me by Mr. Torres that we do have 3 people on the phone. So right now, just for those 3 people, if you have a comment or question, you can unmute your phone, press *6. Give me your name. Okay, others, again, you can raise your hand in the webinar. So we are here to address any other comments or questions and have at it. Anyone? And I think when Meg shows up again, we will circle back to that, but. Okay,
Yeah,
folks,
it looks
we
like
are,
she said that she's sorry, but just to let you all know that they are still working on it.
okay. So here we are, folks. We have 1 name in the queue. Anyone else? I ask for more names, not that I don't want to address that. I just want to line up and make sure we're budgeting our time properly. Okay, Jerry Ferroni, please go ahead. You have 2 minutes. Thank you.
You're on mute.
Listing log number 320. This talks about when someone is wanting to change case management agencies and the receiving case management agency states that they cannot accept the person for some reason, but the person has serious needs to move case management services to that receiving case management agency. For instance, their family member, a loved one, Medicaid member has just moved to that area, or some other serious reasons to be accepted by that case management agency. Currently, that is under review with no other comments, and I'd like to have some pick of input on that. Thank you.
Hey, Jerry, what number was that again? I'm sorry,
320.
320. Give me just a second, sorry.
Sure.
All right, let's see. So we're talking about when a person moves to a new area.
No, when a person is served by one case management agency and they wish to change to another case management agency, and the receiving case management agency says that they are unable to accept them for some reason. I want to know what the recourse is for the Medicaid member wanting to make that change in case management agencies. And if they have to, and if they have an appeal right in that case, or what can we do?
Yeah, so Jerry, that is something that we'll have to come up with a formal answer. I think it's a good question, and something that we definitely want to consider as a possibility with our new rules and our expectations for transitioning. You know, if it's a situation where a member has a complaint with their current agency and feels like they're not getting quality case management, and that's the reason that they want a new case management agency, I think that our case management team would definitely be involved in helping resolve what that transition looks like, and consider the reason why the new case management agency would not be able to take on case management for that member. Our team could also step in and identify if there's an alternative case management agency other than the one that they've requested, to be able to provide services for that member. Ultimately, we will be involved in those situations to ensure that every member has the case management agency through the process. Like, that's always going to be our primary concern, right? To make sure that they have an acting case management agency that is providing the necessary support, so they have the service authorizations that they need, and then our team would help support that member in whatever particular circumstance led to that request, and try to find somebody that can take that on. So we'll come up with a formal answer that's probably a little bit more succinct than what I just said, but essentially making sure that the member has case management, and that there's a process to ask for the department to intercede for any communication that needs to occur, and finding a new case management agency would be our focus in those situations.
If we get this information in the mid-July announcement from HICCUF, this is our last CMRD meeting, so we don't have any more chances to give feedback to all of your answers that are going to come in mid-July, and there's a lot of them. That's kind of frustrating. Do you have any comment to that, Kedren or Nicolette?
Yeah,
Go ahead, Nicolette.
Yeah, I can take that. There's definitely going to be time for feedback, getting all of these rules before it's time for us to put them into e-clearance. Once we have everything done, which we are promising for mid-July, if there are still questions regarding what our answers are, then we absolutely would like to hear back from you. You can send those questions to Tiffany or me. I'll add our emails in the chat again. But then there will also be the public comment. So definitely not the last chance. It's our last big meeting to kind of go through some of these, but if you still have those line items, and you feel like the answers maybe weren't clear, you can absolutely reach out to us and we will get those back with you.
Thank you.
Thank you. Thanks, Jerry. So, folks, again, this is John Berry. I'm making a plea for people to raise their hands. As you heard, it is the final meeting, and now is the time. Anything that you want to ask about or make a comment about. In the meantime, SMB, not sure who you are, but thanks for raising your hand. Please go ahead. You have 2 minutes.
Line item 440 and 441. Room and board. And just on 441, Cassandra said, good catch, but then someone else said board means meals and food. 440 is the same thing. All related to that. I'm not sure where that ended up. I know that board means food, but I think for people who are looking at this and agencies who, you know, put the rules out there for their host home providers, et cetera, we need to say meals. That it is a big issue. Somewhere, and I'm dating myself, I'm not sure that I couldn't find it in current rule, but somewhere it could have been back in Making Strides. I don't know. It used to say they had to provide 3 meals. So I just know, you know, if you say room and board, well, I gave them 1 meal, that it leaves a lot of room for open interpretation as to that. We list, you know, the dressers and the bed and the toiletries. I think we need to make something towards the food.
Okay, thank you. This is John Barry. I didn't hear a response from staff, so I think we took that comment, and thank you very much. And we have a quiet group here today. And again, it is the final meeting, folks. So we have almost 130 in the meeting. If there's anyone who, especially if you haven't spoken yet, there's something that you want to bring up, it can be in an entirely different row in this document as I understand it. We move around. Anyone? Questions? Comments? We have a hand. Someone's saving me. Thank you. I know that's not a hand. It was a thumbs up. That's even better. But we do want to address questions. So anyone?
Looks like we're all
Okay.
still also kind of talking amongst ourselves about that last question too, to see.
Okay.
But that's okay. We are still, it looks like it's one that they are still also working on behind the scenes. So
Sorry about that, Nicolette. I didn't quite realize that, but
you're good.
I guess
You're
we
good.
can move to the next one, which actually is Jerry again. So thanks, Jerry. You have 2 minutes.
Yes, I had, you know, I prepared a whole bunch of questions, so I'm sorry to take a lot of time. Let's talk about listening log item number 228. This talks about the CMA will create their own governing board, like a board of directors. I find this really weird. We're trying to get rid of conflict of interest here with the new case management system, but unfortunately, people creating their own governing board, you know, like the employees designing the board of directors for a company, it seems strangely like it reeks of conflict of interest, and there should be a more community or public way to have the governing board for a case management agency designed, not just incestuously, sorry to use that negative word, but it smells, pardon me. So comments, please.
Do we have any subject matter experts that can take that question that Jerry just raised. 228 would like some clarification on who is considered a governing body for a CMA. And Jerry's worry is the CMA is creating their own governing body or board.
Yeah, so Nicolette, this is Kidron. Thanks for that feedback, Jerry. I can say that the regulations that are included in our rule revisions regarding governing bodies are specific to statute that is required for those governing bodies and how they operate. So it's nothing that we would be able to change at this time, given the statutes that would need to change in order for something like this to be changed. But it's very helpful to have that feedback. I would say that one of the things that we are hoping would add to the benefit of not only having a governing body that approves policies and procedures for case management agencies through the lens of case management redesign, but also having the advisory committees that will be present will hopefully be that voice that we would want to really have for advocating for members, specifically in relation to their case management services. So our hope is that having that advisory committee, in addition with the governing board, in addition to case management redesign, all together streamline a better path for members to receive services from their case management agency. So specific to that governing board, that we have to have that language in there continually until statutes change. But that's really our hope, to have the additional things that supports that, in relation to your comment.
Yes, because currently when you have a community center board, they have a board of directors that's more responsive to the community. It's not so self-described or self-invented, or I'll use that bad word, incestuous. Thanks, Kidron.
You're welcome. Thank you for your input.
Thank you, Jerry, again. And Betty, you are up next. Thank you. You have 2 minutes.
Okay, thank you. Currently, there's a huge movement nationally to separate out something called severe and profound autism from what we might want to call high functioning autism. And so my general comment is, when you look at a rule as somebody who's creating rules, I am very hopeful that you look at that rule and say, does this rule apply both to somebody who's severe, profound, requires 24/7 line of sight care, and to somebody who is walking, talking, working, and driving? Because we have one rule and it needs to fit these extremes of a diagnosis. Both people can be in a Medicaid waiver. However, for example, when we look at supported employment and it says, oh, if they're not doing it on their own within 3 months, end of story. That has to have an exception for severe, profound. They are always going to have 24/7 support. Doesn't mean that they shouldn't be able to work, doesn't mean that they shouldn't have those supports, but it's not going to be the same for everyone. And that's my concern, is that we don't have enough exceptions to rules for severe, profound, or for people who are extremely high functioning.
Is this for a specific role area or line item that you're talking about?
This applies across the board. I mean, I've supported employment, anything where somebody requires support and there's some rule that says that support must fade over time.
Are there any subject matter experts that have anything related to Betty's question or comment?
Hi, sorry, good morning. Okay, my name is Jenny Jordan. I'm with the department and the supported employment team. And Betty, thank you so much for that feedback. We are very excited that we are launching a new service within the supported employment realm right now, actually July 1st, for workplace assistance for people who do need that kind of ongoing consistent support. So we are looking at that. The intention within job coaching is to fade back. We don't believe that everybody needs somebody there all of the time. And we want to be looking at those ways we can build someone's independent and making sure that the staff person isn't enabling like a dependency. However, definitely recognize that people do need some ongoing supports. And so we've initiated this new service to hopefully address those needs and make it available to those people. But definitely hear what you're saying on the addressing the full spectrum of needs. Thank you.
And then just to keep us on point and flowing, I just want to make sure that everybody is also sticking to the rules that we've already gone over. If you have any specifics of the rules that we've gone over, I wanted to be able to keep us moving along and giving that follow-up to this rule process. Thanks.
Thank you, Nicolette. Again, this is John Barry. So we'll move forward. And just a quick reminder, if you haven't spoken yet and you'd like to, now is the time. We have Jose Torres next in the queue. Thanks, Jose. You have 2 minutes.
Thank you, John. So back to what Jerry was saying about the ACA. I'm not sure I understand the statutes that are in place. What are those statutes? Are those part of some other law body that I'm not aware of that has to do with CMA's responsibilities to create the CAC? I'm asking because if I remember correctly, this did not exist before the new redesign that we're doing right now, the CAC. There was something, but it wasn't a requirement as far as I know. Some CCBs and CMAs chose to do it, but it wasn't a requirement. Now seems to be a requirement. Am I wrong in that? Oops.
Do you know, can you, it looks like we're not sure. Can you like clarify what your question was? Sorry, Jose.
Yeah, sure. So as far as I know, the CAC was not a requirement until now. Some CCBs or CMAs have chosen to have something like the CAC, like for example our MHS, who has their advisory council something. But I know that some have chosen not to do that. Since this seems to be a new requirement, I'm not understanding why is it that there is already a statute that limits what HCBS can tell them to do or not to do on that.
Gotcha.
So-
Was this go ahead.
Go ahead, Nicole, you're fine.
I was wondering if this was kind of going back to Jerry's question.
Yes, yes.
Okay. Gotcha. and the answer that we provided Jerry about the governing body, and then also asking about that community advisory committee.
Right,
Well,
so,
exactly. I just wanted some clarification on that.
so, Jose, the advisory committee that I was speaking about is what we have new in our proposed regulations. So that is not something that currently exists. You know, Jerry's concern, as I heard it, was that if we keep regulations about case management agencies needing governing boards, what is that going to do for members, to really support members to have, you know, the intent of the governing body? What are they really going to do? How are they really going to help members? How is it really going to change things? Jerry, you can let me know if I misinterpreted that. But essentially, you know, if we keep that in there, you know, how are we really helping members? And I mentioned that in our new regulations, we have the community advisory committee, and that case management redesign, the restructure of case management agencies, all working together is really our intent to make a better system for members. But that we've got to keep that regulatory language for the governing body as it's a statute. Hopefully that helps.
Yeah, but that I guess that's my question. What is statute right now?
I don't have that off the top of my head right now, Jose. I'd have to look that up and get back to you.
We could,
Okay.
once we find that, we can add that into the listening log too, in that section.
Okay, thank
Yes,
you,
please.
everybody. We will move forward, and we have 3 in the queue so far. SMB, you're up again. Thank you. You have 2 minutes.
Line item 450.
Okay, so 450 for provider agency requirement rules. GTube used to say something about until certified as competent, for example, a FCG that has been doing the feed for 18 plus years and doctor signs off on competency. This is regarding the rule 8.75015. Do you have a specific question about it, or just if we have an answer to that one right now?
So just if you have some answers, because when you're looking at it, currently is in 8.614, and it's a little more clear under there about the training and when they're deemed proficient. And in this one, it seems to read like, especially number 6, that the physician nurse observes documents the unlicensed individual and monitors blah blah blah. It doesn't say like do they have to do it quarterly? Do they have to do it monthly, the doctor, the nurse? Or can we add back in until they're deemed proficient? Again, the doctor will sign off on an individual who's on CES waiver, has been G-tube fed from birth or somewhere in there, and the doctor signs off on the certification that this parent, family caregiver, is proficient at feeding their child, and now who is now an adult. And so we don't have to have that monthly, quarterly doctor nurse redoing their feed.
Okay. Do we have any of the provider rule subject matter experts that can answer that question and come off of mute? Okay. Yeah, we can take then that additional feedback and questioning, and we're going to add that into, thank you, that space. And we'll take that back to add as an addition to help with that answer.
Thank you.
Thank you.
Okay, thank you. So next up is Lori Gropa. Thank you, Lori. You have 2 minutes.
Thanks, John. I just want to go back to the governing body comment for a moment and wonder if there's an opportunity to require representation of the people being served on the governing body, perhaps in this context, as opposed to the general definition of a governing body. So I don't know whether there's an opportunity for that, but I wanted to put that out there as perhaps an option. I know, for example, our CCB DDRC has representation on their governing body of the people being served, and we as the ARC have people on our governing body as well, but there's no requirement for us to do that, and I wondered if that maybe was something that would be helpful.
Let's see. So it's looking like we thought that there was. So maybe we just need to go over that a little bit more again, and take back that feedback and look into what we have in the role, and recheck.
Yeah, thank you for that, Lori and Nicolette. Yeah, I believe that there already is requirements. We kept that language from what's in the CCD language for the governing body, I believe. If not, we can circle back and make sure that that's represented there. That was our intent, to keep that in there.
That would be great. Thank you.
Yep.
Thank you, Lori. And before we go to Betty, just again a reminder, if you have something, we are now past the halfway point in the meeting, so please, if you want to bring something up today, it's a really good time. Betty, you're up next. Thank you. You have 2 minutes.
Thanks, John. So the under review, when is that going to have a resolution?
These will all have resolution by mid-July. We are still actively working on them throughout. So you'll see that like there's still quite a few more that we have to get leadership approval to make sure that we're able to, if we're saying that we can adopt or not adopt and things like that before I can put them in here. But there's a lot of it going on and working on the back end. And so we are going to make sure that we get all of those updated definitely by mid-July, and still it's ongoing. I've been going in every day and trying to get more answers and poking more folks for answers. So
Very good. And then you'll be sending out a notice saying the listening log has been resolved or couldn't be resolved, or various announcement.
I can do that. Yes.
Okay, that would be appreciated. Also, when is the CMA announcement happening?
Any of those questions they can't speak to because it has to go directly to our procurement team. I'm sorry.
Okay. Okay, I see something from Jose. Thank you.
Okay, thank you, Betty. So we are currently, let's see, we have one hand raised. And before we get to Jose again, folks, we are over the halfway point. I'm not sure quite when we're going to stop before we wrap up, before 11 o'clock sometime. So please, if you have something, now is the time to do it. Jose, thank you. You have 2 minutes.
Thank you, John. Yeah, I just wanted to voice what I typed in the chat. What Betty said, that's exactly what we want, what we are asking for right now. The draft, the CAC draft that people pass out has representations, has significant representation from departments, providers, CCDs, CMAs, but we do not have, the community does not have significant representation. And when I say significant, I say it kindly. I don't mean to sound like, oh, providers or CTVs or CMA should not. Of course they should. And we need them there. We need the department there. But we also need more representation from the community, so that the significance of the CAC is actually something that governs this whole thing. Because these changes, as you know, any change can be dangerous or can be really good. And we want this change to be really good for clients, for compliance, for protection against retaliation, for protection against discrimination. I mean, right now, we get discrimination cases all of the time. We have, CCDC has 500 appeals giving errors just in the last 3 months. And we are at capacity. And yet, if we were to be true to the community, we will need to file for 500 more.
Jose,
So-
you have 15. You have
Thank you,
15
John.
seconds, sir.
Thank you, John. So that's what I mean.
Yeah, Jose, I think we're definitely on the same page for the reason for that community advisory committee and the goals, and the, you know, hoping to really have that heavy representation from the actual members and community. And I definitely agree with you on all of that. And it's a huge goal of mine to make sure that we are able to do that as well. I know that one of the big things that we've put into rule that was beautifully written along that line was to make sure that those members of the community are the ones that were the more highly prioritized over even over family members, of course. And so I really want to also see that's the way that they work out, and that's how we see it through. But I agree. I think that's a big deal, and it's going to be a big deal for me as well. So thanks.
Thank you, Jose. So I see we have a new person. I'm at that point in the meeting where I'm going to start prioritizing folks that we haven't heard from yet. So everyone bear with me. Jane, you're up next. Thank you. You have 2 minutes.
All right, thanks everyone. Hi, this is Jane Flournoy from CDPHE. I wanted to make a quick point of clarification about something I believe was mentioned a little earlier related to family caregivers. Current state, as per 8.600 regs, family caregivers are in fact required to be QMAP trained. And more broadly, I want to make sure that folks are aware that family caregivers are not presently exempt from any of the IRSS regs and are held to all of the same standards as host home providers and PCA settings. So I just wanted to make sure that everyone was on the same page with that.
Okay, thank you very much, Jane. And quick reminder, now's a good time to raise your hand if you have something that you're wanting to say before we wrap up today. Gary Froney, you're up next. 2 minutes, thank you.
Okay. Listening log number 79, and there are other listening log references to this also. I'm talking about the creation of a cost containment work group. This was brought up early on last fall in the CMRD stakeholder meetings, and yet I've not heard anything yet about a cost containment work group, and it's getting a little late in the game for some new work group, but please respond, whoever you choose, Nicolette?
Yeah, we went over this in our follow-up to our case management agency roles. And Kidron brought it to that meeting and did a presentation and also kind of added like what the new wording is and got some feedback from everybody in that group to see what they thought. And so that one was a pretty positive meeting. We have them all recorded as well, so I can find that particular recording to send to make sure that you're there. But Kidron, did you have anything more to add for that one?
Nothing, just to really call out that we proposed our revisions proposed to take out all of the reference to anything in regulation throughout the entirety of our regulation related to over cost containment language. So our proposed regulation takes that out. And then I would just encourage you to go and listen to that recorded session. It gave the proposed new language, how we are going to ensure that members have the service planning that's needs-based, and that there's a way that we'll still have reviews done by utilization review, utilization management for anyone that's over a specific daily PAR, but that there's a process for that. And we're taking out all of the language that was specific to over cost containment. So based on that work session, based on that webinar and session, the input was that we didn't need a work group since we had elected to take out all of that language. So please feel free to give us an email to Nicolette or Tiffany if you have any remaining concerns about the proposed language for those topics.
I just want to add that it's really hard for some of us to find anything on that case management website.
I'll find that for you, Jerry, and I'll send it to you in an email, that particular recording.
Thanks, Nicolette.
Yeah. Oh, I think she froze. I don't know if she got my message.
Okay, thank you, Jerry and everyone. So now, again, we're looking for, my screen seems to have been frozen up a little bit. I'm not sure. Can you hear me, Nicolette? Am I coming through?
I do hear you. Yeah.
Okay. I don't know what that is. But anyway, folks, we are looking for more comments. We have time right now. It's 10:15. Please, especially if you haven't spoken yet today, raise your hand in the webinar. The button is on the bottom of your screen. If you have it minimized a bit, it's under the more, and then you click there, and then you'll see the option to raise your hand. And for those few people who are on the phone only, you can press *6 right now and give me your name if you want to speak. Okay, we have a large group with a few comments today. So we're either doing everything right or we're not encouraging you enough to talk. Anyone? Okay, hearing none for right now. Nicolette, seeing none.
All right. So, I mean, if there are no other line items that we want to go over for today, this, I think, though, is super helpful for some of those areas that maybe we don't have a full answer to, even to have some of the follow-up and background on what those questions specify. I like that we have this new section for the 627 meeting input. If there are more things that you have from this meeting, particular line items, maybe you're reading the line items and we haven't answered it yet, and you have some more information or detail on that question, go ahead and feel free to send that to me. We can add those into the meeting input. But I think I'll just give maybe another minute to make sure that everybody has gotten out all of their questions that they have for the listening log, line items, follow-up questions to all the rules we've reviewed. I'll just give one more minute for that. Anybody at all? Okay. Well, we really appreciate everything that you all have done. And again, please do not hesitate to reach out to me. It is Nicolette Cordova. In case anybody has had anything bounced back to them, I apologize for that. And we have our names in the chat. If anybody needs to copy the chat, I'll also give another minute for that. But I'm just so grateful for your partnership and helping us through this rule review. All of the amazing things that you've brought to our attention, as you can see again, and all of those accepted and accepted with modification. There's, so many things that we wouldn't have caught without all of you, and it's a big deal, and we really want to make this right. So thank you for doing that, and reach out anytime. By mid-July, we'll get those done. If I get another big chunk done before then too, then I'll send out an email. But I really appreciate everything, and our subject matter experts who have just worked tireless hours on all of these rules and getting all of these questions and updates in there. Thank you. And HCBS Strategies, who has been doing so much work behind the scenes. You can't imagine. We wouldn't have been able to do all of this without them either. So I really appreciate all of you. And I'm going to say goodbye, and I'll just stay on for one more minute in case anybody needs to copy the chat. Thank you all. All right, thank you, everybody. Have a great day. I'm going to sign off. Bye.